right, so we're still in chapter 4, looking at lab values, and we're gonna go to the chart on page 70. All right, so we're looking at white blood cells, or WBCs. The common reference range is 4,000 to 11,000 cells per millimeter cubed. So the white blood cells are used to diagnose and monitor infection and inflammation. So you can increase as an acute phase reactant, which would indicate a system reaction to inflammation or stress, for example, surgery. So actually the better way to say that sentence would be can increase or can be elevated as an acute phase reactant, which would indicate a systemic reaction to inflammation or stress. And the example would be when a patient is undergoing surgery or a surgical procedure. So you may have elevated levels of white blood cells due to a patient taking steroids, due to a patient taking epinephrine, and also due to colony stimulating factors. You may have reduced levels of white blood cells when a patient is on clozapine treatment, when a patient is taking chemotherapy. So chemotherapy that would target the bone marrow. When a patient is on carbamazepine, cephalosporins, immunosuppressants, vancomycin, and procainamide. Next, we're going to look at neutrophils. So neutrophils, the common reference range is in a percentage. So the common range is 45 to 73%. And in the notes, it does say neutrophils and bands are used when or with clinical signs and symptoms to assess the likelihood of an acute infection. White blood cells are used in the absolute neutrophil count, or the ANC calculation. We can look that up again to review in Calculations, Chapter 4. Also, neutrophils are called polymorphonuclear cells. They may also be referred to as PMNs or polys. So neutrophils are also called polymorphonuclear cells or segmented neutrophils, SEGs. The next section that we're going to look at is called bands. The common reference range for bands would be pretty low. It's 3 to 5%. And bands in the notes are immature mature neutrophils released from the bone marrow to fight an infection. This would be called a left shift when elevated. Then we also have the eosinophils, the basophils, the lymphocytes, and the monocytes. So first we'll look at the eosinophils. So the common reference range for the eosinophils is very low. It's lower than the bands. Bands was 3 to 5%. Eosinophils is 0 to 5%. So eosinophils would be typically elevated if there is a drug allergy, if there's inflammation, if there's a parasitic infection, and if the patient has asthma. The next section goes and looks at basophils. Basophils is 0 to 1%. Basophils would be elevated in inflammation also, in leukemia, and also if there's a hypersensitivity reaction. And then with lymphocytes, lymphocytes is higher than eosinophils, higher than basophils, and higher than bands, but lower than neutrophils. So the lymphocytes is 20 to 40% for a common reference range. Lymphocytes may be elevated in a patient with lymphoma or with a viral infection. Lymphocytes may be low in a patient with HIV, in a patient who has been taking steroids, and in a patient with bone marrow suppression. The last part of the differential is the monocytes. The monocytes is less than the neutrophils and less than the lymphocytes. It's 2 to 8% for a common reference range. So the monocytes may be elevated in inflammation, in stress, and also in chronic infections. All right, so the next section is going to look at the red blood cells, and specifically it's going to look at different aspects in a patient that may have anemia. So let's dive in here. So we have RBCs, or red blood cells. The reference range for like a male is actually a little bit higher than the female. So it's 4.5 to 5.5 times 10 to the 6 cells per microliter. Females is 4.1 to 4.9 times 10 to the 6 cells per microliter. We have red blood cells, which have an average lifespan of 120 days. So the red blood cells, to review, they could be elevated due to erythropoiesis stimulating agents that a patient may be taking. Red blood cells could be elevated if in a patient with polycythemia, which is a condition that causes, again, high red blood cells or high red blood cell counts. Red blood cells could also be elevated in a patient who's a smoker. Then we may see low red blood cell counts due to chemotherapy that would target the bone marrow, low production of red blood cells, bone loss, which would be a reduction in bone marrow. And if a patient has sickle cell anemia, hemolytic anemia, and the deficiency anemias, which would be like B12 deficiency or folate deficiency. So the next blood value that we're going to look at, or lab value, would be the hemoglobin and hematocrit. So the hemoglobin, HGB, and the hematocrit, or HCT. So the hemoglobin for males is higher than females. So it's 13.5 to 18 gram per deciliter in a male. Female is 12 to 16 gram per deciliter. The hematocrit for a male is a percentage of 38 to 50%, and in females it's lower, it's 36 to 46%. Hemoglobin is the iron-containing protein that carries oxygen in the red blood cells. The hematocrit mirrors the hemoglobin result, providing the same clinical information. So we may see elevations due to erythropoiesis stimulating agents. So we would take a look at the anemia chapter for that in-depth discussion. We may see low values of hemoglobin and hematocrit if a patient has anemia, and we may see low values if the patient is bleeding. All right, so the next lab value we're going to review is going to be the mean corpuscular volume, or the MCV. So this is a range of 80 to 100 fluid liters. In the notes, this will reflect the size and average volume of your red blood cells. The mean corpuscular volume may be elevated in macrocytic anemia due to B12 or folate deficiency. The mean corpuscular volume may be low in microcytic anemia due to iron deficiency. Then we have some values like mean corpuscular hemoglobin, mean corpuscular hemoglobin concentration. We also have red blood cell distribution width. The next value we're going to look at is iron. common reference range is 65 to 150 microgram per deciliter. Iron could be elevated due to taking iron supplementation. It could be low due to blood loss or poor nutrition. Then we also have total iron binding capacity, TIBC, transferrin saturation or TSAT, ferritin, and erythropoietin. Those are all going to be monitored as part of the workup and treatment for iron deficiency anemia or anemia of chronic disease like chronic kidney disease. All right, so that concludes page 70.